Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, the drug effective for treatment and prophylaxis for angina pectoris is isosorbate dinitrate. Isosorbate dinitrate is given sublingually for acute attack and it can be given via oral route for prophylaxis. Whereas pentaerythritol tetranitrate and diltiazem are used only for prophylaxis, whereas dipyridamole actually worsens the angina by causing coronary steal phenomenon. Which of the following statements best explains the action of nitroglycerin on coronary vessels? Nitroglycerin will preferentially dilate the coronary arteries without affecting the resistance arterioles, and thus they cause redistribution of blood flow without affecting the coronary vessels. Next, isosorbate dinitrate decreases the preload more than afterload. Predominantly, we know dilatation of nitrates is due to the reason that veins express larger quantities of enzymes that generate nitric oxide from nitrates. So they differentially cause venodilatation.
thank you and thank you for watching.